Thank you. So also, it has been seen, Dr. Sarin, that in elderly people, sometimes we often are told to ignore the occasional pus cells that we get in urine tests, and there are no symptoms at all. So, is it important to treat them if there are no symptoms?
In elderly people, especially if they are asymptomatic,
Right.
and there's no obstruction. You know, obstruction in the urinary tract, for example, a prostate, or a stricture or stones in a male or female, if they are there, then significant UTI, for example, when the culture shows bacterial count of 10 to the power of 5 or more, that should be treated. But the stray pus cell here and there, the patient doesn't have any symptoms, there is no obstruction to the urinary tract, there's no point in pumping in antibiotics. They have absolutely no role.
Absolutely, because that is what happens whenever we generally get our general checkup and we get the urine tested and there are few pus cells, but there are no symptoms. And, the tendency is to just go in for...
As a matter of fact, asymptomatic bacteriuria in women, not in men, need not be treated. If a woman has significant bacteria in the urine, she doesn't have obstruction, she doesn't have diabetes, she is not on immunosuppression, she is a normal woman, it does not have to be treated because it will not cause any problem. If she comes to know, just drink a lot of water and things will be sorted out.
Absolutely. Wonderful. Dr. Sarin, so there is a question now that we hear of recurrent UTI, that is infection occurring again and again and again. And so why does this happen? And especially if there is no underlying cause like renal stones or prostate enlargement.
No, recurrent UTI is defined when there are more than 2 episodes of urinary tract infection in the last 6 months or 3 episodes in the last 1 year. And this is because of alteration of the bacterial flora, and also because in the uroepithelium, sometimes bacteria get entangled, enmeshed in the urinary, the uroepithelium. And therefore, you have to give them, of course, we found out that there's no obstruction, there's no immunosuppression. In this, we have to give low-dose antibiotics for 6 to 12 months, like nitrofurantoin, 50 to 100. First, we treat the infection, then we give them long-term antibiotics like nitrofurantoin, 50 to 100 mg daily at night, after meals, or try methoprim, sulfamethoxazole, especially if the person is not allergic to sulfur. So there are other simple antibiotics which can, in low dose, can be given for 6 to 12 months, and this is recommended.
Okay, but of course, people have to take it under supervision of the doctor.
Yeah, always under. Yeah. Once the doctor decides that it is recurrent bacteriuria and there is no other underlying cause,
right,
then we give low-dose antibiotics for a length of time, because otherwise she'll be very hassled and disturbed by recurrent episodes. And then very often we are able to get rid of the bacteria and she does not have episodes of UTI.
Fantastic. Doctor, you just said that bacteria love the diabetic blood and they love the sugar. So diabetics, they really get troubled with UTI repeatedly. Any special advice to them, please?
Look, in diabetics, diabetes is bad for any and every part of the body, right from head to toe. So therefore, the bacteria love not only the blood, the hyperglycemia, the excessive sugar in the blood, but the excessive sugar in the urine. Right. So very often they have glycosuria, and the bacteria have a feed. And you see, nature has made things in such a way that if the fasting sugar is 100 and the postprandial is 140, nothing goes wrong. Moment the sugar is 120, 130, and the postprandial is about 170, 180, bacteria will come in. So we must control the important thing is diabetes is very common in the obese, especially in the type 2 diabetes. So obesity should be curtailed, the dietary restriction, exercise, so the lifestyle modification should be done. And then of course we'll have to treat the blood sugar. We have to treat with medication or dietary alteration so that the blood sugars remain normal. And the normal blood sugar, fasting is 100. Postprandial, 2 hours after a meal, is 140 milligrams %, and an HbA1c, which tells us the blood sugar status for the last 3 months, it should be 6%. Anything higher is diabetic. So if once we control this and then we give a course of antibiotics, we will get rid of the infection.
Wonderful. So the next obvious question is, Dr. Sarin, what would be the general line of treatment of UTI like? What is the process like?
Look, in uncomplicated UTI, we will give them a short course of antibiotic for about 5 days. We don't have to give long, but there's no immunosuppression, there is no diabetes, the woman has just had an episode of UTI. And then we can alkalize the urine to alleviate the symptoms. Then we can give, non-antibiotic like cranberry extract. This is not an antibiotic, but it is a fruit, as the name suggests, which help to, on the fibria of the uroepithelium, they get attached and they do not allow the bacteria to come there and cause the inflammation. Then, of course, we've got simple antibiotics like nitrofurantoin, we've got trimethoprim-sulfamethoxazole, and then sometimes we can give, it is not done commonly under the supervision, medical supervision, in very difficult cases, intravesical, that is injection into the bladder. Of course, this has to be done by the doctor.
Right.
And as Dr. Bhatia already mentioned, that in young women post-infection, drink a lot of water after sexual intercourse, don't use spermicidal creams, and use if somebody post-coital develops UTI, then you give them a short course of antibiotics. So cranberry extract is very interesting, and in recurrent UTI, you must use. Otherwise, the simple antibiotics. It's only in complicated UTI that we use the quinolones and the other drugs, which of course the doctor will prescribe.
Wonderful. Dr. Sarin, there is any chance that while we are treating a woman who is breastfeeding, it would affect the baby who is,
No, trimethoprim-sulfamethoxazole should not be given to a baby who is 3 months old. I mean, breastfeeding a baby who's 3 months old. After that, we can give it. And then simple antibiotics like nitrofurantoin, cephalosporins in the form of cefotaxime and all can be given for UTI. So can nitrofurantoin. So these antibiotics, simple antibiotics, are safe even during breastfeeding.
Great. Thank you so much, Dr. Sarin, and this has been wonderful, and thank you so much for sharing your experience and invaluable advice. Our attendees and we too have benefited with better understanding of what, why and how of UTI. Of course, this will remove many misconceptions and anxieties. And of course, we will invite live questions from our audience at the end of our discussion, and we look forward to further advice from you later. Thank you so much.
Thank you.
Yeah. So going forward, the diet, the exercise, de-stressing, and other healthy lifestyle measures have very significant impact on our well-being. So let's first see how diet impacts UTI. So I'm pleased now to introduce our next panelist, Dr. Deepti Verma, who with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC Skill Development. She has been a lecturer, a medical nutrition consultant, an editor, and she has been felicitated with several awards to her contribution towards nutrition, including a Lifetime Achievement Award. So welcome to the webinar, Dr. Deepti, and let's see, we have questions coming up for you. And the first one, of course, is can our diet help us manage UTI? What would you suggest to that? Dr. Deepti?
Yes. Am I audible?
Dr. Deepti, can you hear? We've lost her. Okay, we will come back to Dr. Deepti. Meanwhile, let me touch upon related problem of urinary incontinence, the loss of bladder control, which is such a common and often embarrassing problem as we get older. This severity actually ranges from occasionally leaking of urine when you cough or sneeze, or having an urge to pass urine that's so sudden and strong that you can't actually reach the toilet in time. So to prevent this urinary incontinence, we do have something called as pelvic floor exercise. Now, which is also called the Kegels exercise, which help hold the urine in the bladder by strengthening the muscles involved. So daily exercises help keep urine from leaking when you sneeze, when you cough, when you lift anything heavy, or laugh, or even have a sudden urge to urinate. And these exercises also may help avoid infections by strengthening the muscles that help empty the bladder. So what are these Kegels exercise, and what muscles are we talking about? Actually, these pelvic floor muscles, they are in the form of a sling, and they are down below, which hold the bladder and other organs. And in fact, you can try stopping urine midstream. When you're passing urine, you just try to stop it, and that's what actually are the muscles we need to exercise, that is holding your bladder or trying to stop passing urine. And that's what is contracting the pelvic floor muscle, because these muscles, as we age, they become lax, and simple sneezing also cannot stop the flow of the urine. So you just need to hold the bladder for at least 3 to 5 seconds at a time, and do it as and when you remember during the day, which is a good start, but gradually build it up to 3 sets of at least 10 repetitions every day if you're suffering from it. And the best part about Kegels exercises that nobody else will know that you're doing them. So not only Kegels exercise, any physical activity in general can help prevent bladder problems. It can also help maintain a healthy weight, because we've seen overweight people display a higher tendency for UTI and leaking urine. So making healthy food choices, being physically active can help manage the weight and the UTI. And of course, it has been seen that those who spend a lot of time sitting, say more than 5 hours or so, and or maybe having low physical activity in general, are more likely to experience incomplete bladder emptying, increased urinary frequency or urgency, a weak urinary stream, or having to get up frequently to urinate at night. So the fixes: whenever you are sitting for long hours, try to get up after every hour and take a round, go for 5 minutes around, walk around, or maybe better still, get a standing desk, right? So let's see if Dr. Deepti is back. I don't think she's getting the network. Anyways, so when we talk of the diet for UTI, we need to have the acidic diet, or the diet which has more of the colas, more of tomato based, or the junk food, and all the acidic food make our pH of the body acidic, which is a breeding ground for bacteria in our body, so also for UTI. So try to have alkaline food, fruits, vegetables, healthy grains, and probiotics, prebiotics. And of course, Dr. Sarin also mentioned about the cranberry juice. Dr. Sarin, would you want to talk about the cranberry juice?
So Dr. Ghei, I'm back. I think I just lost y'all for a bit.
Oh, okay. Welcome.
So welcome
Am I
back.
audible now? I'm so sorry
Yes.
about that. There's some network glitch here.
No worries. Welcome. So nice to have you back, Dr. Deepti. And we already had introduced you. So welcome back, and let's get started. So how does the diet help the UTI? I started off with some information, but there you go. You're the expert here.
Yeah, so as far as the diet is concerned, it's very important to keep the diet alkaline. So alkaline diet basically comprises of whole grain cereals, fresh seasonal fruits and fresh seasonal vegetables. So consumption of that makes the blood very alkaline, and an alkaline body is always a fitter body and has a better immunity. So of course, like we have to avoid all the acidic foods like tea, coffee, alcohol, nicotine and processed foods, which are very, very important to be kept off, when someone has recurrent UTI issue. The second very important thing is the constant intake of pre and probiotics. So pre and probiotics, they breed the bacteria, and probiotics contain the bacteria. So some of the foods that I would recommend is bananas, cabbage and cauliflower, the cruciferous vegetables, which are very good prebiotics. And other than that, of course, is avocados and raw onion and raw garlic. They are considered to be very good as prebiotics. And as far as the probiotics are concerned, it is all the fermented food, and it is also, like curd, which has a lot of live bacteria in it. So these foods can be taken in more quantity. So that's second, pre and probiotic foods. The third very important thing is intake of vitamin C, but through non-citrus foods like amla, guava, the coriander chutney that we normally take here in India, the green chutney, which is very, very rich in vitamin C. And of course, like amla, which is the Indian gooseberry, very rich in vitamin C. Fruits like papaya, watermelon, muskmelon. So these are supposed to be taken because vitamin C, almost about 4 grams is required, to beat the UTI and the infection and builds in immunity. And another very important thing is to cut down the white sugar, because it is said that white sugar drastically drops down the action of the white blood cells, the WBCs, that actually gives the immunity. So yeah, these are primarily, of course, other than that, as Dr. Bhatia and Dr. Sarin have already spoken, intake of water has to be increased.
Absolutely. So we come to the next thing which we were talking about, and Dr. Sarin also mentioned about the cranberry juice. How does it help us?
Okay, so cranberry juice indeed is actually all cranberry extracts for that matter. Now we get pills and all also, and there are different supplements of cranberry. So cranberry extracts, basically they contain, as Dr. Sarin has said, that they avoid, the bacteria clinging on the walls of the urinary tract. And second is they contain hippuric acid, which behaves like, an antibiotic, a naturally found, antibiotic compound like, and which also is very anti-inflammatory in nature and also prevents the symptoms of the UTI like frequent urination, burning, etc. And besides that, it is very, very rich in cyanase, because it's, like anthocyanins is something which is very high in, the cranberry extracts. So hence, it is actually highly recommended to be having the cranberry extract.
Wonderful. That's so awesome. Thank you, Dr. Deepti. And of course, food is always of special interest because it's 100% within our control, and wise choices can have such a significant impact on our health and well-being. Right. Thank you once again. So it's time to take a few questions. So Dr. Sarin, there's one of our viewer, Asmita Madan, and she says that, is it safe to use intimate hygiene products like toilet seat spray, toilet seat covers, intimate wash, etc.?
I don't think so. What is important is wherever, if you're talking of toilet seats, keep them clean. You can use a detergent.
Right.
Keep your seats clean, keep your bathrooms clean. I don't think there's a need for anything special.
Okay.
You're not going to get UTI from your seats, you're going to get UTI from yourselves.
Okay.
As we already said, it's coming from your, Dr. Bhatia had also said, and I'm repeating, that from your own anal area, and therefore clean from front to back, in women especially, clean from front to back and not back to front. and there is no need to use fancy things. Just keep everything clean.
Great. So Reena Barad has asked that if there is a cyst on the upper side of the urinary tube, what can we do for the treatment?
No, you see, which urinary tube are you talking about? Are you talking about the ureter, or the pelvis of the kidney, or the urethra? The cysts are not commonly, I see so many kidney and nephrology. I don't find cysts. Cysts are common in the kidney itself, and most cysts are benign and we do nothing about it.
Great.
We don't have cysts, and I can't remember, I have a big practice. I can't remember seeing cysts in the urethra or in the ureter. So I don't think we have to worry about cysts, but if you have a cyst here and there, you will have to go to your doctor or to your urologist.
Yes, thank you, Dr. Sarin. So there's another question, women suffering from urinary incontinence, and I talked about the Kegels exercise, and if that's also not helping, what is the next best thing to do? Because it's very, very embarrassing and very, very difficult time if you can't control your urine. So what do we do?
Is that a question for me? Yeah.
Sorry?
Is that a question for me?
Yes, sir.
Look, we have to make sure there is no pathology, like infections. If there is if whatever pathology there is, for example, somebody has a tumor in the bladder, malignant tumor, or an infection, or cystitis, and that is the cause, we have to treat the primary cause. But if there is nothing, there is no pathology as such, and we call it stress incontinence, and it is more common in women, then of course there are now plenty of drugs available. Drugs which will, the overactive bladders, there are drugs to quieten the bladder. For example, darifenacin, solifenacin, there's a new one called Mirago. So there are plenty of medicines available which are pretty safe and can be used. The medicines are available, and of course, if there is a cause for the incontinence, then the doctor will treat that.
Great.
One doesn't have to worry so much because there is medication available.
Okay. Thank you so much. Dr. Deepti, there is a question for you, and the viewer is asking that the cranberry juice, should we have the fresh cranberry and then make the juice, or we can have the the stored one or the packaged one? Is it fine to have that?
So if one can get the fresh cranberry juice, of course, it's always preferable to have that. Otherwise, there are cranberry extracts which are available online. In fact, today while I was on my way to work, in one of the most popular stores in Delhi, I saw cranberry juice extract, so which was available in a very ordinary kind of, an outlet. So it's available everywhere these days because of its requirement and nutritional benefits. But yes, otherwise the extracts can be ordered online.
Yes, the only caution that we need to take care is that it should not have sugar mixed with it, and especially for diabetics, we do have some sugar-free packages also, right?
Yes, there are unsweetened cranberry juice, and it's mentioned on the packages that it is unsweetened because diabetics are very prone and susceptible to be having the UTI. So hence, most of the cranberry juices and extract that comes are unsweetened.
So the question just popped up is, how about just having cranberries rather than the juice?
Okay, so actually this is needed in larger quantity. If I talk about the quantity, so like anthocyanidins which are present in the cranberry are required in the quantity of almost 35 milligrams. So that could come only when we have the juice, because otherwise we'll have to eat a lot of cranberry. That makes actually 2 glasses of juice. So that will become a little too much. So because of that, we need to actually drink in a fresh juice or whichever way, so it has to be fresh for sure.
Okay, great. So I think, let me just check if there are any more questions. Okay. So somebody has asked, please tell again, from Nikita, she's asked, please tell me again about the exercise. So yes, Nikita, I will repeat for you. This is the Kegels exercise that we are talking about. So this is to prevent the leakage from the bladder when, because the muscles which form the floor of the pelvis, or at the lower end of our abdomen, pelvic floor, there are muscles which form a sling, kind of it's like a sling which holds our bladder. It helps to contain the urine whenever there is a pressure or anything. So you just need to contract these muscles. And how do you do that? You do that as what you do when you're trying to hold your urine, when you're very, very urgently wanting to pass it. So when you're holding it tight, that is what is the contraction of the pelvic floor muscle, which is called the Kegels exercise. And I said, if you want to try it, you can do when you're passing urine, midstream, try to hold it. Try to stop the urine, and that is what is the contraction of the pelvic floor exercise. You can do it whenever you want to do it. Nobody can know that you're doing it, but it will really help you to a certain extent to hold the urine and not just have the leakage whenever you lift heavy thing or laugh or sneeze, So that's what is the Kegels exercise. Okay. All right, so that's about it. So let me just try to summarize. And we have told again and again, don't hold your urine in your bladder for too long. It can weaken your bladder muscles and make bladder infection more likely. Use washroom often and whenever needed. And be in a relaxed position while passing urine. This will make it easier to empty the bladder completely, especially for women, hovering over the toilet seat, especially when we are traveling and we don't want to sit on the toilet seat. And so that it's hard to relax, and it's best to clean the seat and sit on the toilet seat and then pass the urine. Take enough time to fully empty the bladder. Don't be in a rush and apply excess pressure, which may not allow the bladder to empty completely. And again, this is very, very important. Dr. Sarin, Dr. Bhatia have already talked about it. While using the tissue paper, wipe from front to back after using the toilet. And women, especially women, because the gut bacteria from the anus can get into the urethra, and this step is very important, especially after passing stools. So also Dr. Bhatia mentioned urinate after sex to lower the risk of infection. Otherwise, bacteria from the bowel or vagina cavity can pass into the urethral opening. Like I said, do pelvic floor exercises, especially if you're getting older. That will really help you. Exercise regularly. Physical activity helps prevent bladder problems and also actually helping you maintain your weight. And because overweight people are at higher risk for UTI and leaking urine.
Dr. Anju, one last comment.
Yes, please.
Some of them are asking about 𝗨𝗏. So they want to know 𝗨𝗏 health. So 𝗨𝗏 is nothing but monosaccharide. It's the same thing like in cranberry juice. So to reiterate, it works. It's got direct, like Dr. Deepti was saying, antibacterial, but somehow it works very well against 𝗍. Which is the main culprit in UTI. But one thing is very important to remember, that if you're going to think that you're going to take 𝗨𝗏, which is like cranberry juice and other berries also, and be all right, it's not going to work. You need to supplement it with a proper antibiotic. But where, yes, it really helps, this is the take-home message, that if you have to take medication for long, like 6 months, a year, in chronic UTI and recurrent UTI, like Dr. Sarin was saying, then you must supplement with cranberry extracts. Very, very.
Great.
And lastly, there are enough cranberry tablets now available with concentrate. Like Deepti said, made a good point that you need a very high dose. So drinking, glasses are not going to help, and you'll be taking so many calories, whatever. They may be minus sugar, but you will get calories. So best is to take those tablets and take a good brand and especially in chronic cases. Take home message is very important, antibiotic plus 𝗪-mannose, because the ladies, some of them are asking about 𝗪-mannose. So this is the thing about 𝗪-mannose.
Okay. Fantastic. That was really helpful, Dr. Bhatia. And of course, not to forget water. Like, drink enough water. That's the best thing. And
Right.
that's the treatment also, and that's a prevention also. And
Drink enough water and not beer.
Absolutely, I was coming to that.
It's evening now.
Limit alcohol and caffeine, because drinking
acidic
alcohol.
urine.
Yes, absolutely. Drinking alcohol and caffeinated drinks will actually make you pass more urine and irritate the bladder and increase the symptoms.
They say in the evening a smoke and a drink brings smile to a man's face, but the bacteria are also smiling down there.
Absolutely.
So,
yes, and not to forget, avoid constipation also. Too much stool built up in the colon can put a lot of pressure on the bladder and keep it from expanding the way it should. So eating, like Dr. Deepti said, eating plenty of high fiber food, whole grains, vegetables and fruit, drinking enough water, and of course being physically active can prevent this from happening. And not to forget, smoking. Bladder problems are very common among people who smoke. It has been seen, and smoking can actually also increase the risk of bladder cancer. So it's best to take steps to quit. So that is all about the summary, and of course we've had a good session, and I would like to just say that at VLCC our focus is on the combined benefit of managing diet, activity, lifestyle to keep our clients healthy and well for life. And that is why our team of doctors, physiotherapists, nutritionists, therapists, wellness counselors, we all work together on custom designed regime for each client to help them achieve their wellness goal, and not only just weight loss and body shaping. So thank you all for attending our webinar and guiding our conversation with your wonderful questions. And special thanks to all our panelists, especially Dr. Ashok Sarin and Dr. Bhatia and Dr. Deepti for all your learnings today. And we really hope now all of you have better understanding of your health, for yourself and for someone you may know. And if you wish to know more, there is a VLCC center near you where our team of experts is waiting just to meet you. So wish you all a very healthy life filled with happiness and fulfillment, and a very good day to you. Thank you so much.
Good night, everybody. Thank you. Thank you.